this revolution brought about by Dr. Rutledge in bariatric surgery has not only changed the lives of the patients, but also has given a peaceful life, peaceful nights to sleep to the doctors as well, because of low complication rate.
Right.
Especially talking about converting the band to sleeve or band to bypass. Because in the band area, there is a deep scar. You see, if you keep some rubber band here, you will see that, mark by evening. But eventually, if it is kept there for years together, then it will give you a deep impression there and a scar. Because of the scar, when you fire the staple across the scar, there are, high chances of leakage. And that is why we don't recommend doing the surgery in one sitting. But with mini gastric bypass, how we do this in one sitting, because MGB is a low pressure system. There is no obstruction at the outlet.
Okay.
The outlet is wide, as you can again see in this barium which we did. This which you are drinking will come down. This is coming down. Here it goes into the stomach and it's going out right away.
Right.
Without any obstruction. So if there is any tightness, any band or a sleeve here, that is a high pressure system. And if there is a high pressure system, and we know in this area you had the band scar.
Right.
So if it is tight at the outlet, then there are some chances that the band scar area might give way, and you can have a leak in that area.
Okay.
So that is the reason why we don't recommend doing the revision surgery together while taking out the band, but it is possible only with mini gastric bypass, because it's a low pressure system and the chances of leakage with mini gastric bypass are, I would say, more than 10 times less than other procedures which are high pressure. And again, that low pressure system is giving you some less nausea and less chance of vomiting, because food is going down easily.
Right.
And eventually what we see, even 10 years, 15 years down the line, because it's a low pressure system, that dilatation is less. Because it's already a little bit bigger. That the outlet is wide, whatever you are eating goes down into the intestine, and this is the intestine, it goes down easily, but then intestine has to handle the food. Intestine is a thin-walled, narrow tube. It cannot handle big volumes. So the moment you eat like one slice of pizza, maybe 2 slices, intestine will expand.
Okay.
And then it sends signal to your brain that you don't want more.
Right.
But at least it gives you the luxury to have a moderate amount of solid food, and any kind of solid food, may it be chicken or vegetables or fruits or whatever. And that is why we see these patients are not pushed towards soft calories, because if you had moderate amount of solid food and if your brain is satisfied, then you don't want more. Then the cravings go down. And
that was one problem with the band. There were certain foods I would not be able to eat, and then I would have those cravings, and to satisfy those cravings I would have wrong food, which caused weight gain.